Welcome to my channel. Today's topic is child abuse and neglect. I, Dr. Gitanjali, am a dental surgeon. So today we will discuss about the topic child abuse and neglect, which is derived from pedodontics of 40 year subject of dentistry. So let's start. Contents. In this, we will discuss about introduction, definition, prevalence in India, predisposing factor, characteristics of abused child, type of abuse, sign of abuse, battered child syndrome, dental neglect, 5 key of observation, Indian law for child abuse, child protection agencies, management and prevention. So without wasting time, let's start. Introduction. What is child abuse? Childhood should be carefree, time filled with love and joy of discovering new things and activities. Child abuse and neglect is an increasing social problem. Nowadays, this child abuse and neglect is increasing day by day. The effect of the child abuse and neglect are not limited to the childhood, but cascade throughout the life with significant consequence for the victims. So, by definition, according to Gill in 1968, it is defined as a non-accidental physical injury minimum or fatal inflict upon children by person caring for them. By dental neglect, the failure by parents or guardian to seek treatment for usually untreated caries, oral infection, or failure of parents to follow through out with treatment once informed that the above condition exists. This definition is given by American Academy of Pediatric Dentistry 2010. So, in India, what is the percentage of prevalence of child abuse and neglect? India has the largest number of children involved, nearly 40% of its population. 69% of the Indian children are victims of physical, emotional, or sexual abuse. 89% of the crime are committed by the family members. Predisposing factor. What are the main factors that causes child abuse or neglect? Parental characteristics, child characteristics, environmental characteristics. So one by one we will discuss each categories. Parental characteristics: violence, poverty, less adequate maternal functioning, social isolating. These are the main points which causes parental characteristics of causing child abuse and neglect. Next, child characteristics: unwanted and unplanned child, number of children in family, child's temperament, position of the family. Environmental characteristics: chronic stress, problem of divorce, unemployment, poor housing, alcoholism, drug addiction. All these characteristics of the environment related to the parent causes more child abuse and child neglect. Next, characteristics of child abuse. There are two types of characteristics: the abused child, the abuser. So, the abused child, some of identity feature of the abused child are unduly afraid or passive child, evidence of repeated skin or other injury, child is undernourished and is given inappropriate food or drink, evidence of poor overall care. By this point, we can recognize that the child is already abused. The abuser. Child abuse can occur in any cultural, occupational, social, economic, and ethnic group, but a higher incidence is found in minority and low income family. Parents may have following characteristics which may indicate abuse behavior: poor self-esteem, violent temper or outburst, avoidance of looking at or touching the child. This causes the abuser. Next, the history. How this comes? So we have to know the history. So in this, it is categorized into three. Eyewitness history. Child himself state that injury is caused by the parents. One parent accuses the other about the injury. Unexplained injury. Some parents deny knowledge of the injury. Others can tell about the injury but can offer no explanation. They hope others believe that the injury was spontaneous. Next, Alex self-inflict injury. An Alex self-inflict injury in a small baby is most serious in general if a child cannot crawl, cannot pose self-injury. Next, type of abuse and neglect. Type of abuse and neglect: physical abuse, sexual abuse, failure to train. International drugging or poisoning, Munchausen syndrome by proxy, health, medical care neglect, dental neglect, safety neglect. Next, emotional abuse and neglect, physical neglect. These are three categories which have subdivisions. So this is a photo given below which shows how a child is abused or neglected by the parents or the relatives or the society. Physical abuse. Now we will discuss about physical abuse. Physical abuse means shaking, hitting, burning, suffocating, drowning. It is one of the most common type of child abuse, which incidents being more than 10%. In this case, the child is physically injured. Next, history. Correct questions to be asked. Eyewitness history. Child state that injury is caused by the parent. We should ask the parents, the child. One parent accuses the other about the injury. Unexplained injury, vague explanation, no explanation, inconsistent explanation, delay in seeking medical care. Sign of physical abuse. The term battered child syndrome was coined to characterize the clinical manifestation of serious physical abuse in young children. If a child come to our clinic or hospital, by looking at the physical sign, we can know that it is physically abused. So this child's are called as battered child syndrome. Battered child syndrome was given by Dr. C. Henry Campy in 1962 in the Journal of American Medical Association. His article leads to passes of law in all states requiring health professionals to report to welfare department. Now, clinical finding. What we will see in the body of the child that indicate that the boy is or the girl is neglected or abused. Bruise, marks, burn, laceration, fraction, abrasion. And physical child abuse. So these are the 3 points which show that bruise in child. Inflict bruise occur at the typical site or fit in a recognizable pattern. Accidental bruise, it draw knowledge of common and unusual accidental bruise. Bruising will help in recognizing inflicted injury. Unusual bruise, some common ethnic practices can result in bruise that should not be confused with the child abuse. Typical sites of inflicted bruise. So these are some points: buttocks and lower back patting, genital and inner thighs, cheek slap marks, earlobe pinch mark, upper lip and pronounced force feeding, neck choke marks. Next, type of abuse. Location of bruise, genital or inner, what we have discussed before. You can note down it. These are the marks: human hand mark, strap mark, lash mark. Grab marks are oval in shape, mark that resemble fingerprints due to holding of the child in violently shaking. Strap mark 1 to 2 inch, white sharp border, rectangular bluish of various length. And lash mark narrow straight edges, bruises or scratches caused by thrashing with a tree branch. Next, fractures. Fractures can also occur in child abuse. These are diagnosed in up to a third of the child who has been investigated of physical abuse. Often occult fracture. 80% of all fracture from abuse are seen in children under 18 months. Sexual abuse. Prevalence had increases dramatically, but reporting in less due to following. Culture moral doesn't have visible physical sign, inability of clinician to identify. In sexual abuse, we doctors can not identify the signs or symptoms because most of the child or the parents don't reveal the truth. Sexual abuse victim, this is it's mainly occur in female, ratio is 1:9. Effects in emotional effect, guilt, anxiety, functioning. These are the effects causes in the child who are sexually abused. These are some pictures of sexual abuse. Sign of sexual abuse. Following are considered when the child has difficulty walking or sitting, nightmares, bedwetting report, experience of sudden changes appetite, become a pregnant, runs away, reports sexual abuse by parents or any other adult. Emotional abuse. It is a malrelation which result in impaired psychological growth and development. The involves word sections and indifference. Example: verbal abuse. Whenever murderer, father scold the child with verbal abuse, then the child are emotionally abused. Etiology is stressful life of the parents, family stress, and this causes effect in the child are lifelong pattern of depression, low self estimate, lack of empathy. Signs of maltreatment. These are the signs of maltreatment. Show extreme in behavior such as ovary complaint or demanding, has attempts suicide, in delayed in physical or emotional development, constantly blames, belittles or betrays the child, overtly reject the child. This is a chart of child neglect. You can note down it. It is categorized in five: physical neglect, medical neglect, educational neglect, inadequate supervision, and emotional neglect. Neglect. In dental neglect, it is present in high occurrence despite the little importance it is given. Parents do not give attention of the dental or the oral health of the child and they neglect it. Many of the diseases like caries, pain, infection, bleeding, trauma. Dentist is a child abuser. Sometimes the dentist himself abuse the child by hitting, slapping, offensive language, overuse drug and apply physical strain without parental consent. This is a syndrome, Moshigan syndrome by proxy, is given by Dr. Richard Esser in 1951. He reported adults who fabricated symptoms about themselves and produced signs of illness. Dr. Roy Meadow first coined the term motion syndrome by proxy to describe the preservation of the description in the rear to the child. Now, five key observation. How will you say that the child is really abused or neglect? The nature of relationship between the child and the parents, the child reactions and behaviors towards other people, the child reactions towards medical or dental examination, the general demeanor of the child or the parent. Indian law for child abuse. India has no law for child abuse, physical abuse, sexual abuse. In physical abuse, violence in home, Indian Penal Code IPC 323 by IPC 324. Sexual abuse, if occur in girls, then statutory rape IPC 376. In boys, unnatural sexual offense IPC 377. There is no law which protects child from others type of abuse like emotional and educational abuse. Only these two categories has been identified, has been reported. Now, guidelines for the child protection in India. These are the guidelines. You can note down it. Child Protection Agency. There are many agencies which stand for the child. National Human Rights Commission (NHRC), in India policy is concerned authority. So, how will you manage management? Physical, dental, and medical treatment. If the child is physically abused, then it should be treated with dental and medical treatment. If emotionally, then psychological counseling. Now, educating the school children and making them comfortable to confine in their parent, teacher, etc. Family counseling and education must be performed. Management, medical treatment for better child syndrome will vary according to type of injury. Counseling and implementation of an intervention plan for the child parents are necessary. If child have a sibling, the authority should determine whether they have been abused for about 20% of sibling of abused children. are also shown to exhibit sign of physical abuse. Next, prevention of child abuse. How can we prevent the child abuse? Strengthening the family, public awareness, creating supportive communities, prevention program, evidence-based practice. These are the four main points by which we can prevent child abuse. So thank you for watching my video. If you like and want more video to be uploaded, then please do subscribe my channel. Don't forget to like or subscribe. Please click the bell button so that you get notifications of my upcoming videos. Thank you.